In this video, I want to talk about B-type natriuretic peptide. Think about the word natriuretic. You have the Na for sodium, uretic, uresis. You're going to urinate more sodium. We know that water follows sodium, so you're going to decrease your blood volume and therefore decrease your blood pressure. In the heart, we have a couple of different hormones that are released. So the heart is actually an endocrine gland. And you have the atria. When they stretch, you're going to release atrial natriuretic peptide, ANP. It's going to go to the kidneys and cause uresis, through sodium loss. If you have stretch in the left ventricle, it's going to cause release of B-type natriuretic peptide. That's going to cause sodium loss at the kidney level and therefore loss of fluid. It's going to decrease our blood pressure. So the clinical significance of this particular BNP is that if someone comes in and they have difficulty breathing or dyspnea, then that could be a pulmonary reason or it could be cardiac, like heart failure. And that's what this looks at, is does the patient have heart failure? And this can be a key player in that diagnostic workup. So if you take blood levels of BNP, a normal blood level is going to be 100 or less nanograms per liter. But if someone has more, that could be suggestive of heart failure. And you could look at other clinical symptoms, such as do they have fatigue? Do they have swelling in their extremities? Do they have dyspnea? You would want to do an echocardiogram at some point to kind of bring in that whole clinical picture. Now, one thing to keep in mind, you can use BNP not only to help diagnose heart failure, but also to see the progression. Is it getting worse? Is your treatment improving it? For example, beta blockers, ACE inhibitors, diuretics, all these things will decrease BNP levels. So if a patient is already on these drugs, that's one thing to keep in mind when you're trying to diagnose heart failure. And then also if somebody has chronic kidney disease, they have elevated levels of BNP. So it's another thing to keep in mind that can kind of alter these blood values.